being 8:33, I'm going to call the meeting to order. Could I get a roll call, please?
Hendricks. Krager. Here. Van Hoff.
Here.
Sullivan.
Here.
Shorten. Altoff.
Here.
Von Bergen.
Here. Next, could I get a motion to approve the minutes for November 20th?
Can we have a motion to allow
Oh,
Altoff?
yep, sorry.
Thank you.
Could I get a motion to allow member Altoff into the meeting?
I'll make the motion.
Okay.
I'll second.
Thank you. All those in favor?
Aye.
All right.
Thank you.
Motion carries. Welcome. Next, could I get a motion for the minutes approval for November 26th?
I'll make the motion.
Ms. Krieger,
Second.
Ms. Van Hoff, all those in favor?
Aye.
Aye.
Against, motion carries. Thank you. Public comment?
None signed up, Oswald?
Okay.
Alex? Sure.
All right, thank you. Next, we'll move on to member comments. I just want to really quickly welcome the new members. We've got a good group of people here, so hopefully we'll be able to continue to do good things. Are there any other member comments? Ms. Altoff?
I'm good, thank you.
Okay, and seeing no new business, we'll move on to the routine consent agenda. Could I get a motion to approve 6?
I'll make that motion.
All right, Ms. Altoff motions.
I'll second.
Mr. Sullivan seconds. Could I get a roll call, please?
Krager. Here. Yes. Sullivan.
Yes.
Van Hoff.
Yes.
Altoff.
Yes.
Von Bergen.
Yes. All right, moving right along. No old business, and we're up to discussion for the health department hierarchy. Will you be leading that discussion, Ms. Adams?
Well, that's a good question. Pam, did you want me to lead the discussion on the hierarchy?
Yes.
Okay, I have a slide. I think I'm in my computer. I can just plug the flash drive into the,
Yeah.
it's just mine.
While he gets ready for that, can you guys hear me okay?
Yep.
Yep.
I just wanted Melissa to take a few minutes because the Department of Public Health is a little bit different than many of our other departments. And for new members and maybe even some of our older members, it's just a good idea to have her come and explain how that whole department works.
It worked on my cube.
It's not being read by the computer.
Can you get her an invite, Kathy, so she can send you a Teams invite if you want to share your screen to that, otherwise we're not
okay.
the members will be able to see it.
Yeah, and I think it's important to see the structure. It'll just make the conversation, I think, a little easier. Okay, so Kathy, you're sending me this way. Okay, sorry.
She's gonna send you a Teams invite. You'll
Here.
find- Yeah, on your computer.
Oh, and then I'll be in, I get it, okay.
Sure.
Do I have to turn anything off? With audio?
When you're joining the meeting, you can just not include your mic or camera. Camera and speakers off. Feedback, yeah.
Okay. Now I will pick.
Here.
Okay, how do I make it so that it fills the whole screen? Can you see that okay? I can try to, let me see, I can make it bigger. Oh, what just happened there? All right. Okay, well, I guess going bigger is not exactly going to happen. Okay, so this is essentially our organizational chart. The Board of Health oversees the Department of Health. It's a 12-member board made up of 2 physicians. These are the mandated ones. So we have mandated members who have to be on the Board of Health. That's in the statute. 2 physicians, a dentist, a nurse, and then the county liaison are those mandated members. Then the rest is members at large. We've had restaurateurs on our board. Right now we have a farmer, we have a firefighter, we have someone who's worked in, has closer ties with like animal control and that expertise. And they serve 3-year terms on a rotation. So every year there's 3 to 4 members who roll off and on. We currently have all our members filled. We have one person who's has resigned but will stay until we find another physician. So there are 2 positions that the Board of Health hires directly. That is the public health administrator, so that is myself, and the medical advisor. Actually, that should have been changed to medical director. We just recently changed their title to medical director. So if the person who is in the public health administrator role does not have a medical degree, is not a physician, then you do need to hire or have a contract for medical consulting services for the clinical components that we do. So you'll see the dashed line of the medical director to myself and to the nursing division. We have 5 divisions. Community health is our newest division. It used to be rolled up under nursing. And so we have health administration. That is where we have our sort of centralized overarching components of the health department, our strategic planning, operations. We do some HR components there. We have a staff development coordinator. Community information, that's our public information officer. We do vital records. We are the county registrar. And our fiscal. So we have a 4-member fiscal team. Then in environmental health, a lot of our mandated services are under environmental health, food, sewage, and water. Under nursing, we have our surveillance team. We do women's health. We do our communicable disease control. So that's everything from, again, flu surveillance, immunizations, maternal child health. We do TB under the nursing division, so we still do treatment for TB and identification of latent TB and active cases. Community health. We have our chronic disease prevention program and our community resources. So under chronic disease, we do things like screen for diabetes or certain chronic diseases. We do education around that. We offer classes, diabetes prevention program. Community resources, we go out into the community and we connect people to and link them to resources. We do vision and hearing screenings for the schools and preschools across the county. We do our MAP, our Mobilizing for Action Through Planning and Partnership. This is another requirement as a certified local health department. Every 5 years, we are required to do an assessment and an improvement plan. That falls under community health. That is a really big project that we will be starting here in 2025. Our certification is due in 2026. Our Medical Reserve Corps, these are the folks that step in, have different qualifications. They can actually have a medical background, but they could be lay people who help in the event of emergencies. We do tap them for all kinds of ongoing components. Emergency preparedness and response is under there too. Let me see if I can scroll down just a bit. So this is the team that works on planning and response plans. They help with, when we do vaccination clinics and coordination and logistics. They manage our PPE supplies. And then our WIC program, which is Women, Infants, and Children. Then finally, animal control is also under the Department of Health. And, that again is, we have ordinances that drive our regulations around animal control, which is essentially our primary function. There is our registration, rabies prevention, so registration and vaccination. But we do education in the community. We also operate an adoption center. We have 121 FTEs under the department, and they're about 10 in health administration. I won't do all the math because I'm sure I'm going to get it wrong, but I think about 25 in environmental health, about 30 in the nursing, another 25 in community health, and about 21 in animal control. And Pam, I don't know if there was anything specific that you wanted to have me cover.
If you could maybe enumerate how many of those services are required by statute from the state.
Well, the food, sewage, water, and communicable disease are all mandated services. So, and then the rabies control and prevention. Vital records, because we are the registrar, that is a service we offer. That is a fee for service. The fiscal, so those are the primary required ones. WIC is fully funded by grant dollars, and the surveillance, that's part of the communicable disease control. So that's our epidemiologists who are combing through all of that data. They work with schools. They help identify outbreaks in schools. Schools report up to us for flu surveillance. We work with the hospitals. We work with the coroner on opioid surveillance. So there's a lot of activities that the department does, even if they're not technically mandated, that help promote health and prevent disease spread in the county. Also, the Board of Health does have the statutory authority to enter into contracts and to staff the department. In this county, however, we do go through this committee, and then that stuff, we don't control our budget independently, right? We have to come to the county board, present our budget, and have the county approve it.
I could touch a little bit on animal control. You referenced rabies and running a rabies program. That's clearly the responsibility that the state has given the county. The adoption component of animal control is a little more vague in terms of what we really need to do. We run a very good adoption system, and our municipalities and police departments have really come to rely on us running a really good animal control and adoption system. But there are elements therein that could be done differently, and some counties do them differently. But we're doing a great job. But again, we got municipalities really leaning on us to run that good animal control system.
The other thing that we do, really on behalf of the county, because it's a county function, is the solid waste program. But that falls under the Department of Health, and it actually falls under our environmental health. So all those recycling events that we do, the contracts that for solid waste that we work with various townships and the county where there are no garbage pickup, for example, that goes through us.
Thank you, excellent.
Are there any questions? Kind of a high level, quick and dirty overview of what happens at the health department.
There's a lot.
And Pete, maybe can I ask, can you touch a little bit on the fact that the county board and the finance committee actually do review the budget from the department? I mean, that we still have authority over that?
To be sure, and it's the Board of Health is appointed by the county board, and it operates with a mix of general fund support, grants, fees, and I think it ends up being less than half of the funds come from the general fund. But it is a big operation, and the county board has absolute oversight over how that budget's laid out.
Well, thank you very much. I know Melissa is always open to questions, so further down the road.
Yeah, and if anybody ever wants to, thanks for that. If anybody ever wants to come and walk through our facilities, whether it's animal control, our clinics, we have a water lab downstairs where we test, primarily people's wells. You're welcome, just reach out and I'd be happy to connect you or give you a little tour.
Maybe Melissa, spend one more minute and I throw you a curveball here. Pre-pandemic, we were at like 125 health department employees. I'm using loose numbers here. Under your leadership, we kind of had brought that number down a little bit, and the pandemic came. I think you said we're at 121 now. You want to talk about, what positions or where we're at in terms of staffing as pre and post pandemic, and where you see things going in another couple of years?
Yeah, I think we were actually at like 130 or something, and then I think we came down to 105 or 109, and then obviously we had to staff back up for things with the pandemic. We do have, I believe, 5 positions who are currently under ARPA. So those were intended to be evaluated. They do sunset with ARPA, but give us time to evaluate whether or not those are positions that we would continue to need. Because there's a lot of post-pandemic work that needed to be done that the state is helping or encouraging the departments to do. We still have respiratory diseases right now. We're very high in all of our respiratory diseases. I think right now we are in a good place to continue to evaluate how many positions we need. That does fluctuate. We are continuously, like today we brought you a resolution where we're rethinking, what our needs are. And we are, instead of hiring a nurse, we are going to go with a health educator. It's a broader, it gives us more flexibility to utilize that person across our chronic disease program. So we are continuously doing that. And, but I think we're in a good place right now with total staff members. And then obviously we'll have to reevaluate that over the next 2 years as those ARPA dollars.
And with grant dollars, you sometimes are responding what the priorities the state is placing on it.
That is true. And so if those circumstances change, then we would have to reevaluate our staffing needs. But sometimes grant dollars come with positions. And so that would be reflected in the resolutions that come before you to make it clear that it's a grant-funded position. Pam, did you start to say something?
No, ma'am.
Okay.
Okay. Seeing no other questions, thank you very much. I do highly recommend any of you who haven't taken a tour of the facility in Crystal Lake that you should try and set something up because it's
Yes,
a
and
great facility that's in need of some things, and I know we're in the process of
that's
doing
right.
that.
So if you want a tour now, actually, it might be a great time to do a tour so you can see sort of the before and after. Because beginning here in February, March, we've already started to move some staff out. We are going to be moving some staff into most likely another location to lease some space while we are doing the renovations. Animal control essentially is getting renovated as well, but we don't have anywhere to move those animals. So the animals will stay, the officers will stay, and we just have to do a little internal moving around to accommodate staff and the services. But all the clinical staff will be moved out. That side of the building gets remodeled first, and then we'll move on to the other side of the building. So if you wanted to see what it looks like now, and then come back and see it once it's fresh and refreshed, maybe that's a better term. Okay, thank you.
All right, thank you. All right, next we'll move on to Senior Service Grant Commission. I'm not sure, Pam, if you want to lead off on this? Sorry to put you on the spot.
What do you want me to say? The Senior Services Grant Commission is a commission that was developed by the county in response to the referendum that was run 21 years ago, allocating a specific levy for seniors. And it's basically a program that attempts to keep seniors in their homes. So we get requests from, like senior care, senior services, agencies that provide transportation, agencies that provide dental care, agencies that provide resources to our seniors to do whatever it is. Recent example is Donna Kurtz is working very collaboratively with senior services to get the message out about being able to have a portion of your taxes deferred. So, and that's a senior only program. So we do those kinds of things. And it's required for the department or for the Committee on Public Health to appoint people to the Senior Services Grant Commission. As vice chair, I am the chairman of that committee, and I report directly to Tracy on all of our activities and what we're doing. Kind of proud over the last year, the board increased the levy. We have about $2 million every year to allocate to various agencies that have to do a total presentation in front of the commission. And also very proud of the fact that we worked with Donna Kurtz to invest monies that we aren't currently using, and we made an excess of $5,000 this past year. So we're kind of being a little bit more professional.
Okay, great. Pete suggested I get a consensus.
Historically, the Senior Service Grant Commission was made up largely of people from public health and community services. A couple years ago, we kind of made a transition that we really needed to spread that service gift to other commissions. So we asked that because transportation and senior transportation is such a big part of the Senior Service Grant Commission, that we do now have a representative from the Transportation Committee. Paul Thomas drew that straw last week, so he's going to do that. I think if we can affirm Pam will be your liaison, again, that would be wonderful. I think Pam's ready to accept that challenge, and then we need to find a representative from Finance Committee later this week.
So with Pam chairing, there's also another member from Public Health.
Is there?
Yes.
Okay, then we need to pick one.
Dina has graciously
Thank you.
asked to work on this commission, and it's really a great commission, and it really kind of opens up the,
About 4 meetings a year with
Yeah.
2 big meetings.
All day, all day. Mhm.
isn't just one of the days, the long, or is it like a
Actually,
day and a half?
it's actually 2 days that are long, but the one that's really long from 8 until 3.
Okay.
Could Pam just email me? Pam, could you just email me the details and the schedule?
Yes, ma'am.
Thank you.
Yeah, I noticed those were on the website, so
And what's that
that
website?
would be,
Do you have a website here? Pam, just email it. It'll be fine.
Tina, I'll
sometimes
take
it's
care of it.
difficult
Okay,
to,
thanks.
yeah, sometimes it's a little difficult to find, but thank you,
Sure.
Tina. And if I could just get I guess a consensus to keep Pam as the chair and for Dina. Yes?
Yeah.
Yeah,
We need to make a
yeah,
formal
you
motion
good?
for it.
I don't think we need a formal motion, but
Consensus that
if
everybody's
we're
on board.
kind of all in agreement. Thank you, Pam, for leading that commission.
Thank you.
Okay, and of course, Mike Bueller will make the final decision on that. All right, so moving along, under reports, an update on community developments. Welcome, Sarah.
Yes,
I
welcome,
got the
Sarah.
chance to come down and meet you officially.
Dina, I'm gonna move this
Welcome
just
aboard.
so we don't have the
Welcome back
Thank
aboard.
you.
cafe looking down the
No
bar
problem.
type effect.
So, good morning.
Good morning.
It is nice to meet all of you. Just wanted to say, very happy to be working as the new Community Development Administrator for the county. And when I say new, I mean starting week 6. So
We're really excited
A lot
to
to
have you as
learn,
well.
yeah. Just a little bit about me. After I graduated from law school, my first position was with the city of Carbondale, supervising a federal VAWA grant, as well as the agencies associated with that. But for the last 18 years, I've actually been an executive director for various non-for-profits in the area. So gained a lot of grant writing, grant research experience at like the federal and state and local levels as well. Also worked for Senior Care Volunteer Network for 5 years, so pretty familiar with the issues that seniors in the community face, and then worked with Pads of Elgin, so very familiar with homelessness issues as well. So looking forward to working with all of you. As far as some updates, sorry, I'm gonna put my readers on here. All of the senior services grants have been sent to the agencies, and most have been fully executed. I think with the holidays, we're still waiting on a couple agencies to get those signatures back to us, but sent out a reminder on that. The CAPER, the Consolidated Annual Performance and Evaluation Report, is complete, and that will also go out in January this month. Funding will also be coming in from EFSP, or as I refer to it, FEMA. And as soon as that is announced by the local board, then we will publish the NOFO on that. For those of you who may or may not have met Connie Jensen, she is the new Lead Hazards Program Manager, and we have been working a great deal together on policies and procedures for that program. We've done a complete revision of the work plan that will be resubmitted to HUD, and we've also created a marketing plan for that as well, which will, of course, significantly increase community outreach regarding that program. We've also had meetings started with the team regarding the 5-year consolidated plan, which of course is due to the county board for review in June. The consultant is actually starting today.
In an hour.
In an hour. So very excited about starting that whole process. As far as an update regarding homelessness, we did, I believe, right, attach the analysis
Yes.
of impediments to fair housing.
I hope so.
And that will be open for public comment in January, and so obviously the committee's been provided with a copy of that to review, so. But again, very excited to be here. I look forward to working with all of you, and just so you are aware, I do have an open door policy, so feel free to email, call, stop in anytime. Be happy to meet with you. So, thank you.
Welcome. Would
Yes. Go
Would
ahead.
you mind, I guess just real quickly, kind of explaining to us again how this department is mostly funded? and
Yeah,
everything?
absolutely.
I think
So-
it's important to kind of know.
Yeah, so community development is a little bit different than all of our other divisions. And they kind of operate as a bank. They receive federal, some state funding, some competitive grants, but the lion's share of funding is HUD, is federal. And those are formulated grants, formulated disbursements that are based on really a lot of what we're going to talk about with the analysis of impediments, is based on different demographic, socioeconomical levels, percentages above or below certain average mean income levels, homelessness and homeless populations. So it really dives deep into some of the details of the county and what and the residents and what services either they have or are impeded from obtaining. So those and to go a little bit further into that, we talked a little bit about the CAPER. CD operates on a 5-year cycle. That 5-year cycle is our consolidated plan. So it's a strategic plan that goes forward every year. Every 5 years. Every year, we do an annual action plan. And that really sets forth with what this program year we're going to try to tackle. Next year, and that CAPER that Sarah talked about completing, that's that year-end closeout. So it's a reflection back, an evaluation report of how did we do on that annual action plan. And we'll talk a little bit about some of the fine-tuning that we're doing with that over the past couple months, definitely over the last 6 weeks with Sarah being here. And then another, so those are the programs that are run through the formula. An example of our competitive grant was the lead program. That was one that we competed for. We got now a second round of it. Those are pretty prescriptive in terms of deliverables and markers and how many houses we're going to get, how much money you get is very specified and capped. So those and then the spend down. So all the programs run the same. It's just a matter of how we actually get them. Any questions on that? Feel free. As we come up, there's always we'll have a couple of reports, some of the stuff when we do resolutions. A lot of those are going to be dictated resolutions. So something maybe HUD comes out and says, hey, we changed the program requirement. In order to move this, you have to get a resolution signed by the county board. So those are going to be the lion's share, I would say, of our resolutions that we bring forward to this committee as well.
Does anybody have any questions? We will
All right.
move along to the...
We'll stay here, yeah.
Yeah, stay there, and we'll now talk about fair housing.
Sure. So again, it's just kind of the same. It's the same breath. With Sarah coming in over the last 6 weeks, we've looked at a lot of different programs, just operationally. This particular piece is probably the biggest project that we have in that it's step one. The analysis of impediments is step one of our consolidated plan. Essentially, it's a snapshot. It's a set data point collected from all the other data points that drive our programs. So we take U.S. Census Bureau information, CMAP information, different planning requirements, policies, procedures, all the socioeconomical, I don't know, it goes on. It's about a 20-point list that's actually in maybe page 8 or 9 of the analysis. It's all a requirement from HUD to affirmatively further fair housing, so, and to comply with the Fair Housing Act. What, over the past, and why I brought up, these past 6 weeks and the past 90 days, what we recognize is that our division didn't do its role in terms of bridging some of that gap between the county and the municipality. This consolidated plan is our best opportunity to fill that role, or at least understand how we can do that better. And really what it comes down to is to beef up our formula. And there's a talk at this committee a few different times of how do we get more money through CDBG? We've had about the same 2.1, I forget, maybe I'm mixing the numbers up now, but the same amount of money since 1998. So it's been a long time of static growth. Hopefully this works, but if it doesn't work, at least now we'll have that communication line, that gap filled, because what we've done in the past wasn't exactly checking all the boxes in terms of need from what municipalities needed or service providers. And so Sarah mentioned the consultant, so we've seen this opportunity. We have a vacancy in one of in our division that we're simply not going to fill this year, because long term we don't think it's financially supported. That we've repointed towards a consultant, and that particular person is a former city administrator for McHenry, deputy city administrator Woodstock, community development director before that. Really knows the language, knows the partners, and this is one of our best opportunities to pull our weight in terms of filling that gap. So we're super excited where this project's going to go. This again is just a snapshot, the actual analysis of impediments. There's no board action. It's a mandate from HUD. It's really what we're putting it out for public comment is to obtain whether or not this is factually, if what we've understood from all the different research and data points, if that's truly what's going on in your community. So, any questions on it? We know that there's a few little things that we found even over the weekend, just some numbers that maybe got carried over. So if there is something that jumps out at you, don't hesitate to let us know. All right.
Okay. Seeing no questions, thank you
All right.
very much. Thank
I invited Adam over at 3 o'clock today to talk a little bit about fair housing with Chairman Bueller and just bring him up to speed on what's going to be unfolding and talk about a couple other things in housing and homelessness. So thank you, Adam, for that.
Hey, no problems.
Thank you.
Yeah, definitely.
Okay.
I'll return back.
Moving on to future topics. I'd like to keep this on the agenda just to, I guess, keep it open. I'd like for everybody to be heard on this committee. So if there's ever a topic that you want to know a little bit more about in the future, throughout the year we do have a certain number of presentations from the different boards and so forth. But if there's anything in particular that you guys want to see on future agendas, we will. This is kind of the place to throw it out there. So I'll just leave it at that. And see anything under executive session. So I'll ask for a motion to adjourn. Mr. Hendricks?
I'll
Mr.
second.
Sullivan? All those in favor?
I
Aye.
Against? Motion carried.